It's Dr. Amanda with StraightSmile Solutions, StraightSmileSolutions.com, and today we're going to talk about extractions. And you know I'm not a huge fan of extractions, but occasionally they happen with Invisalign and the sequence of appointments and kind of the timing of appointments. And I'm going to make this video for both consumers and doctors who are learning and just want some opinions. And ultimately, there's no easy answer here. I think if you're a consumer, you should ask your doctor how that's going to work. If you're a doctor, here's some tips and tricks as to what I recommend. So different types of extractions, right? You can have impacted tooth extractions like a wisdom tooth that's under the gum and bone, or a baby tooth that maybe just needs to come out, or maybe you have like in these cases, a central incisor or a lateral incisor that we need to take out just due to the bite or due to crowding or due to periodontal disease because we can't move them forward. So we got those. And then also we have, sometimes we take out premolar or premolars. Always, for me, that's usually last chance, last choice, only when we have no other options. So ultimately, like I said, extractions and whether we take it out before or after we scan depends on what tooth it is. So here's what helps me make that decision. So for example, if it's an impacted tooth and it's under the gum of bone, like a wisdom tooth, which is either tooth number 1, 16, 17, or 32, or in some countries we call those 8s, if it's impacted or under the bone, I'm probably not gonna rescan because it really isn't gonna affect the fit of the aligners, right? Now, excuse me, if it's an erupted wisdom tooth, let's say it's up and we need to take it out just because it isn't healthy or because we need to distalize or something like that. If we are moving the back teeth and if we need to fully capture the molar that's in front of it, like 2, 15, 18, or 31, and we're actually translating that tooth, then I will rescan afterwards because I do need to capture the entire tooth. Because if you don't rescan, the software is just guessing what that portion of the tooth is like that's covered up by the other tooth that you're extracting. So it's a guessing game. So you may have more fit issues come up, which may not matter if you're not really moving it, but if you're moving it, you need to have it really, really accurate, right? Central incisor is a tough call because of course it's going to be way more accurate if you rescan afterwards and you're less likely to have issues like nicking the bone and stuff like that. But a lot of times patients want something to wear home. So a workaround could be you could always make them a temporary retainer or even just a bleaching tray, put a Pontic in it that's real soft, something very, very, very soft, not rigid, not moving the teeth. And you can have that immediate retainer ready to go. You can watch some of my videos on how to make a Pontic and you can deliver that. And then when that heals, you can scan. That would be my suggestion. But if you really, really wanted to start treatment, you could. I just don't really like moving teeth when there's still inflammation. It's really not a good idea. So you could always make your first aligner a passive aligner. They will do that if you ask for it, like no movement, and you could throw a Pontic in it. That's another option. But you may want to trim it back so it's nowhere near the site that's healing. That would be my suggestion. But you have to strategize that and put that into your ClinCheck. Same thing goes with premolars. If the patient wants something to wear home, it's a good idea to do something like that. Or you can make that soft temporary retainer option and put the Pontic in it and have it ready for immediate delivery. So again, ultimately it depends on, and also it depends on what type of Invisalign you're choosing. If you're choosing, light or express or moderate or go, you're gonna have limited refinement. So of course you're gonna wanna have that scan be as accurate as possible. So of course you're gonna wanna rescan afterwards. Maybe use my retainer suggestion. Of course it's gonna cost you a little bit of something, but it's gonna make the patient happy and more confident. So I think it's the best way to do it. If you're using comprehensive Invisalign, you get as many reboots as you want. So if something doesn't fit, it's really not a huge deal. It's just a matter of the patient understanding that there may be more fit issues than normal if we do it this way, and they may need to get rescanned, at an inconvenient time. So ultimately, as long as the patient is cool with that and understands the process, that there might be a delay if we wait, and they're not going to be upset, then I'm cool with trying it out and seeing if it fits. It's a bit of a crapshoot, a gamble. So in any case, all right, hopefully that was helpful. So the moral of the story is you do need to strategize this, and I think it's one of definitely the top 10 issues that can come up with complaints I hear from patients. So not with my patients, but I do communicate with consumers quite often. They give me suggestions and complaints, and Certainly we don't work directly with them, but I like to hear their feedback because that's how I create these type of videos. So they get really stressed out about it. So if you're a doctor listening to this, remember that it's important to your patient. So you should definitely let the patient know how it's going to work and get their feedback, because ultimately you're there to give them the best possible smile, but you also want the experience to be a positive experience. So don't assume you know what your patient is feeling, because unless you've been in their shoes, you don't know what they're feeling. All right, thanks so much.